Hi, my name is Gary. I have just recently returned home from the hospital following left knee replacement surgery.
And I'm Tammy, and I specialize in orthopedic nursing. I'm here today to make sure Gary understands the exercises he needs to do since coming home from the hospital and show his family ways in which to help him. First thing that you want to do is make sure you take pain medicine before exercising or going to physical therapy. You need to do that at least 1 hour before going. That'll help you have a more comfortable and more productive therapy session. First exercises that I want to do with Gary is the chair exercises. First one would be the seated knee flexion. Okay, you want to make sure you're scooted to the edge of the chair or the couch, and you want to slide your foot out and bring it back. Okay, slide it out. A way a family member can help is to assist with pushing, sliding that leg back even further, and that helps to increase the bend of the knee. Okay. Next exercise that I want to make sure you know how to do is the seated march. The seated march is where you bring your leg up. Okay. You want to do 10 repetitions with 3 sets, 4 times a day. One more. Okay. Next exercises I want to show you to do are the bedside exercises. If you want to get up on there. First exercise I want you to do are the leg lifts. Family members can assist with lifting. A lot of people aren't able to lift their leg as soon as they come home from the hospital. It takes time to build those muscles back up. Next exercise we want to do are the hill slides. And you just want to bend your knee up, and someone can help just by having their hand under his heel. That way his heel doesn't get sore. It's important to get the bending of your knee to 90 degrees and beyond. Next exercise we're going to do are the quad sets, or the knee presses down. What you want to do is push your knee down into the couch or the bed, hold for 5 seconds, and release. It's equally as important as getting your bend to 90 degrees. It's just as important to make sure you get your leg straight. Okay. Next exercise we're going to do is the passive extension, which is the hill roll. And you can just make this out of some towels or a blanket. You lift the leg and you just sit it, and then it just rests there and it stretches. While you're up on that, you want to do ankle pumps. Ankle pumps are very important. You can do them anytime during the day. You can actually do both feet. It just helps improve circulation, lowers the risk of forming a blood clot. While he's finishing up the minutes on there, I want to review precautions with you. Do's include using a walker. It's very important to use a walker after surgery. You want to avoid falling. You want to use that walker until you're cleared by the physical therapist. Next precaution would be using your TED stockings after you come home from the hospital. TED stockings increase circulation and reduce the risk of forming a blood clot. Very important. Next precaution would be to make sure your floors are free of anything that you could trip on. Small objects such as electrical cords, throw rugs. Some of the don'ts that I want to review would be: don't bathe, swim, or submerge your incision in any type of water until cleared by your doctor. Most doctors say it's okay to shower. You just don't want to saturate that knee or the incision. Next don't would be don't drive until you're cleared by your surgeon. Did you have any questions, Gary?
Yes, if I do the driving with my right leg and my left knee was the one that was replaced, why can't I drive?
Well, one of the big things is you're on pain medication right after surgery, so that would be driving impaired. So that's why the doctors, the surgeons don't want you to drive for at least the 2 weeks until you go back and see them, until they see how much pain medication you're still taking and how well you're doing. Okay? After exercise, it's important to apply ice to that knee. Ice after exercising will help limit the amount of swelling and help reduce the pain. So you do want to put ice on that incision for about 20 minutes after you exercise. Okay? Did you think you understand your exercises?
Yes, I do.
Okay. Thank you and good luck with your knee replacement.